Hi everyone. In this lecture, I'll be helping you to extract goals and interventions from the research that you've been reading. So the purpose of it is to learn how to convert evidence-based interventions that you read about in articles into tangible treatment strategies or clinical interventions that you can write into your treatment plan or into your papers for this class or your capstones or whatever. It can definitely be challenging to take what you're reading that's written in this really technical language and apply it into actual treatment. So what we're going to be doing, I'll be walking you through a few article segments and helping you extract the intervention that's suggested, and then turning it into something you can write into a treatment goal and clinical interventions in like a client treatment plan or a CTP and into your paper. We'll start with some interventions from the Cohen and colleagues article that you were assigned to read this week. And then we'll explore one more example of how to use research to develop goals and interventions for depression specifically. Okay. All right, so let's get started. Maybe. Okay, so here is a passage about behavioral symptoms post-trauma, and this one is from the Cohen and colleagues article. This is something that would be especially relevant in Miguel's case, which is the case that we've been following, because his initial referral was due to verbal and physical aggression at school, but it was the result of a traumatic event, which makes it a little bit different. Now, don't worry about reading all of this right this second, or if you would like to, you can always pause the video and take a read or locate this section in that Cohen article if you want. In the next slide, I'm going to show you a couple of things that I wanted to bring your attention to specifically. Okay, so here I've highlighted a couple things. Don't judge my squiggly highlights, please. Did them by hand. All right, so first we see here that the article says that the initial focus of treatment in these cases with behavioral symptoms as a result of trauma needs to address the behavior while at the same time linking it to the trauma. Now, this seems obvious, but it can be quickly overlooked when we as clinicians know that trauma is at the root of the issue. We may want to jump right in to working on the trauma and developing a trauma narrative and all of that good stuff. But if we come into the treatment planning meeting with the parent and the child, and we have a goal like client will increase ability to cope with trauma through the use of containment strategies, a parent who's here due to overwhelming frustration over the child's behavioral issues is likely going to be turned off because this goal doesn't directly address the behavior problems, and the parent or the caregiver may not understand that link yet between trauma and behavior. So instead, this article is suggesting that we have a behavioral goal first in the treatment plan, and that part of addressing this behavior is linking the behavior and the trauma so that you can, of course, address the underlying trauma as well, while still bringing some relief with regard to the behavioral problems that the referral initially was about. Okay. All right. So here I've written a potential goal for our client Miguel that directly addresses the behavior problems. So it is client will reduce physical aggression, throwing things, hitting, kicking, etc. at home and at school from 3 times per day to 1 time per day over the course of the next 12 weeks. So smart format, goal addressing behavior. Now you might be thinking though that this goal doesn't address the trauma that he experienced. This looks like a goal for like ODD, for example. Or if you're looking at this from a clinical loop perspective or an auditing perspective, you might be concerned that this goal is not directly tied to a diagnosis of PTSD, which is what we've given Miguel. It does address the functional impairments, which is great, but it doesn't scream PTSD goal to you. It really, like I said, might look more like a goal of ODD. So in order to address this really valid point, our interventions for that goal up at the top there must make the link for us. And when we get to the interventions section, you'll see how I tried to do that. But before I go into that, I also want to introduce you to the idea of adding baselines to goals, which in my opinion is simply just not used enough clinically, but really adds to the strength of the goal and helps to create linkage between your diagnosis, your goal, and your interventions. So in this case, I'd add a treatment baseline like this. Baseline, following the experience of a traumatic event, the client began to demonstrate physical aggression approximately 3 times per day at school and at home. This baseline section would go in the same box as your goal when entering it into an online treatment record or a DMH CTP. Okay, if you're doing this by hand, it goes in the same section where your goal goes. By adding this baseline, you create the link back to the diagnosis and the functional impairment in a really tangible way, while still making it clear that you'll be addressing the behavior directly with this goal. Using a separate baseline statement also avoids the need to combine all of this information into a goal, which usually creates a run-on sentence that's confusing and difficult to track. I'll show you an example of one of those next. Here. There we go. Okay, so here are some confusing goals. The first one, client will improve management of trauma symptoms, for example, aggression, nightmares, hypervigilance, etc., by reducing physical aggression, for example, sorry, I have reduced physical aggression twice, my apologies. For example, throwing things, hitting, kicking, etc., at home and at school from 3 times per day to 1 time per day over the course of the next 12 weeks. So as you can see here, the goal is weird. It doesn't flow well. It's a bit difficult to track what exactly you're measuring in it. Are we measuring an improvement in trauma symptoms? Are we measuring a reduction in physical aggression? Really, it's both, but it's hard to understand in this goal. And you can see how going back to this baseline version has both of those pieces of information, but in a way that's really clear. So if you have like a rehab specialist, for example, who's going to be then working on this goal with the client as well, it's really clear what they're supposed to work on. They are working on reducing physical aggression. The trauma piece, the psychoeducation piece, that's all something you, the clinician, are going to do, and you've made the link in your baseline. Okay. And the second goal here, the second of the confusing goals, is actually a really common goal. And it's problematic because it uses increase and decrease in the same goal. But I continue to see this all the time in treatment plans. And it's not technically wrong, but there's just ways to make this so much better by adding in that baseline. So let me read it for you. Client will decrease symptoms of depression, for example, isolation, crying spells, overeating, hypersomnia, etc., by increasing use of relaxation skills, for example, deep breathing, progressive muscle relaxation, guided imagery, etc., from 0 times per day to 2 times per day. So you have to read this goal pretty slowly and carefully to know that you're actually tracking the coping skills increase rather than the depressive symptoms decrease, okay? And so someone who reads this really quickly might think, oh, okay, my goal is decrease symptoms of depression. And so they may track that when they're writing whether or not the client has met the goal, instead of tracking the increase of the relaxation skills. They might just miss that entirely. So again, baseline is really helpful to reduce this. There's also nothing wrong in this case of just doing client will increase use of relaxation skills. Right? Okay, so coming back to our trauma and behavior symptoms goal, now that we've written it and now that we have some research backing it up, we can really easily convert this into something you'd write up in a paper. Okay, so the clear goal, the baseline, is going to be really helpful when you're describing the goal development process in your papers for capstone or for this class. So on the left, I have some information that we would want to include. We've got quotes from the Cohen article, which show that we're drawing from a peer-reviewed source, and then we have our baseline and our goal to show that we, the clinicians, know the link between behavior and trauma. It would also be wise to include the article that we read early in the semester about the manifestation of trauma symptoms in children in a more behavioral way, but in the interest of time and space, I've left that out, okay? Remember that since I wrote the baseline and goal, I don't have to paraphrase it or rewrite it differently. And if it's appropriate, I can just stick it straight into the narrative. In this case, I made some minor modifications, but it would be okay to use the baseline and goal verbatim in your narrative, assuming you wrote the baseline and goal. You don't get to just take mine. Okay, so on the right, I'll walk you through writing this up. First, in what you can see here, I've shared the baseline and how the behaviors are linked to trauma. Following the traumatic experience of witnessing his father's violent detainment and subsequent deportation, the client began to exhibit behavioral symptoms of trauma exposure. Okay, this makes it clear that I know this is not a behavioral disorder that we're looking at. Okay? And then I get into more specifics. Specifically, Miguel's trauma response included physical aggression, for example, throwing things at school, fighting with siblings at home, and verbal aggression, for example, yelling, verbal defiance, shortly after the traumatic event that have endured, for approximately 7 months. Next, I'm going to continue the paragraph and add in the empirical support for my claim that the behaviors are trauma related. When clients demonstrate behavioral symptoms of trauma, it is recommended that clinicians focus on the behavioral symptoms first, while making it clear that these symptoms are directly tied to the experience of the trauma. in-text parenthetical citation. It is helpful to address the externalizing behaviors which are causing the most functional impairment while simultaneously beginning to address the underlying trauma gradually. In this way, parents and caregivers can be assured that the behavioral issues are not being ignored and that they are being taken seriously. Okay? So this makes it really clear that I'm not just making this up or that I am not just avoiding the trauma because I don't know how to treat it, but that I'm using research to inform the structure of my therapy and the development of my goals. And then next, finally, now that I've established the problem and why I'm approaching it this way, I introduce the goal and stress the collaboration that should be going on in goal development in order to remain in alignment with our ethical codes about client autonomy. So you can see here how I've written the goal into a narrative and begun the sentence of interventions, which is where I will move next. So it says, accordingly, the client, caregiver, and clinician collaborated on the development of a treatment goal to address behavioral symptoms and underlying trauma. The first treatment goal developed is, and then plug your goal right in, client will reduce physical aggression, blah, 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 blah. Then, in order to work toward meeting this goal, the therapist would, and then I would go into interventions. So coming back to the Cohen article, we get some information about potential interventions for our goal of reducing aggression. And don't forget the recommendation we already got about psychoeducation. In case you forgot, it was, quote, we found it helpful to provide psychoeducation about the connection between the behavioral problems and the trauma. Okay. Specifically in this passage here, we're encouraged to work on emotional regulation, which is a component of TFCBT. The first sentence that I've highlighted goes nicely with the psychoeducation intervention. Then in the second paragraph, we have some tangible things we can do with a client to improve anger control and subsequently reduce physical aggression. Now, once again, here I've pulled out the components we might want to include on the left, and use them to create the clinical intervention on the right. Now, in the CTP, the client treatment plan, you'll also need to include the client's role. And if you're working with children or adolescents, the family's role. So I've included those here just as an example as well. Okay. So interventions, the therapist will provide psychoeducation about the link between exposure to trauma and behavioral symptoms in children. What's the client's role here? The client's going to journal about his anger and feelings about his father. And the family's role, because we have mom involved specifically, mother will encourage client to express his feelings using words and provide positive reinforcement. I've done the same thing in this one for the remaining two interventions. Here's the passage on the left that I'm pulling from, and then the interventions and roles on the right. So remember, this paragraph's about emotional regulation and anger control. So I have here, therapist will help the client to recognize the physical and physiological warning signs of anger, for example, clenched fist, racing heart, and sweating. And therapist will help Miguel to identify, practice, and implement calming or interruption strategies, progressive muscle relaxation, diaphragmatic breathing, etc. What is the client's role for each of these? The client will include physical signs of different feelings in his journal, and client will practice using calming and interruption strategies daily. Family's role, mother will provide praise when the client is able to use calming and interruption strategies. All right. Now that you've written the interventions out, writing them into your paper is pretty straightforward. To keep you on track, I've pulled out the components we might want to include on the left and started writing them up on the right. And we'll start with the psychoeducation one. In order to work towards meeting this goal, remember that's from our goal narrative, right? So I just brought that in here. The therapist would begin by providing psychoeducation for the client and caregiver in order to normalize the aggression response to trauma. It would be helpful for the family to understand that Miguel is likely exhibiting anger and aggression out of fear and attempts to protect himself and his mother. After experiencing trauma, children often respond with anger, defiance, and aggression. Parenthetical citation. Helping Miguel and his caregiver to understand this link will help address the symptoms in an appropriate and helpful manner. Okay. Again, you can bulk this up, provide more information, more details, maybe creating a more clear link between his fear and his symptoms. But this is just like a really simplified example, okay, of how you're integrating everything. Next, we move into the anger control strategies. And now remember, you don't have to include all of these. I've included myself the identification of warning signs and the introduction of the calming and interruption strategies. Okay. Again, I haven't elaborated on these in the interest of space and time. It would greatly strengthen this paragraph to add a few sentences explaining each intervention. Let me read it to you and then I can give you some ideas for what you might add. Once the family understands the link between trauma and aggression, so nice transition from the psychoeducation one to this, the client will help them to address behavioral symptoms. Miguel's aggression has contributed to impairment at home and at school and necessitates response. In order to help Miguel reduce aggression, the clinician will help him to gain control over his anger using the emotional regulation component of TFCBT. And then I have my reference. Specifically, the therapist will help the client to recognize the physical and physiological warning signs of anger. Next, the therapist will help, I should say Miguel, not the Miguel, to identify, practice, and implement calming or interruption strategies, including progressive muscle relaxation and diaphragmatic breathing. So how you might add to this, how exactly would you help Miguel to identify his physical warning signs? You might even look for research that gives you guidance on doing this with children. Similarly, you'd want to add more about the use of PMR and diaphragmatic breathing, perhaps something about teaching these strategies with children specifically. Okay, so this will provide you with one of the required goals in the CTP, as well as the 3 required interventions and the things the client would do based off of everything that I've given you. And you've now converted it into a nice narrative that could be in your paper, assuming you bulk it up a little bit. Okay, so I'm going to provide you one more example of how to extract research-based interventions for another mental health issue you might encounter, and that would be depression in adolescence. And I'm going to be using CBT for this one. So we'll set the stage first before we get into this here. Let's imagine we have a 15-year-old female client that you've diagnosed with major depressive disorder, and her primary symptoms are hopelessness, hypersomnia, and isolation. So doing a search of the literature, I found an article by Lodes and Chalder that focuses on CBT for adolescents who have depression. And the first paragraph that you see here is a direct quotation from their work. They're encouraging the use of activity scheduling, which is basically what it sounds like, scheduling activities to help the client feel mastery, achievement, or enjoyment, and to reduce behavioral responses that are going to contribute to depression. In the case of our client, her isolation and her insomnia. Now, being a responsible researcher, I noticed that this passage also cites a different author, the Veal 2008 article. So I went and found that author and located the relevant information. As you can see in the second paragraph, the Veal article, though it is outside the recommended 10 years old research, does provide a really helpful description of the purposes of activity scheduling that I can then use to develop an intervention. So I've highlighted the components that seem the most relevant, and I will then pull them out to use for the development of my goal and my intervention on the right here. Okay, so the goal that I developed based on my client's symptoms, the client will reduce isolative behaviors, for example, sleeping excessively, skipping school, ignoring peers' text messages, etc., from 7 times per day to 3 times per day over the next 3 months. Okay. Now I'm going to write up the activity scheduling interventions based on the information I have on the left from the research I've read. Okay, so I have therapist will introduce client to activity scheduling and help her to create a personalized activity schedule. Okay, and this is based on this recommendation. They said this is a good thing to do with depression and adolescence. Next, therapist will provide structure and guidance to help client identify and monitor the effect of her scheduled activities and any deviations from the schedule on her mood. That's based off of the very last bullet point on the left from Veal 2008, monitor the effect of their scheduled activities and deviations from their plan on their mood. Okay. And then the therapist will work with client to add coping strategies and pleasurable activities to her schedule based on her interests. And so that is the second to last bullet point there, include activities that are soothing and pleasurable as rewards. Okay? And it's also pulling off of my own knowledge about coping skills and depression, which is kind of obvious, right? So there you go. Now, just as before, now that we've written the interventions out, we can easily convert them into a narrative and incorporate the research that we've gathered. So here it is. To assist the client in reducing her isolative behaviors, the therapist will introduce the skill of activity scheduling. Sometimes called behavioral activation, activity scheduling involves creating a structured hourly schedule of activities that the client will follow in order to address and reduce the behaviors that contribute to depression. Citation. When creating her personalized activity schedule, the client will be encouraged to think of the scheduled activities as appointments with herself that will help her to take small steps to meet her goals. Citation. Activities to address isolation might include scheduling a coffee date with a friend, attending school, or even setting a bedtime and wake up time. And these are just based off of things that maybe came up with my client. It would also be important to include the coping strategies the client is learning in therapy in her activity schedule. Once the activities have been scheduled, the therapist will help the client to develop a method for identifying and monitoring or ranking her mood before and after each activity as recommended by Veal. Okay. Again, more detail can and should be added to this narrative, but this gives you a nice idea of the bare bones of an intervention description in a paper that is research informed and not just something you're coming up with or something you saw on TV. Although those things can sometimes be helpful. All right, so that's it. Those are some examples of how you can extract intervention and goal ideas from the research that you're reading, use it to create your treatment plans, and use it to create your narratives for your capstone or for the paper for this class. Now, in our classwork this week, you'll be doing just that. You'll be pulling out some intervention ideas from an article that you've read. So I would really encourage you prior to class this week when we meet, that you look for an article, if you don't already have one, that discusses some interventions that look promising to you and that you could use for our in-class activity. All right. That is all for this one. Let me know if you've got questions. Thank you for listening. See you later.